here and do some things on demographics and some things that are optimistic, but I actually think we should first jump into the fact we work in a math-free zone. If you listen to the people coming behind the microphones, particularly today, it's as if they've read none of the CBO reports, none of the HHS reports, the other things, particularly in regards to the ACA, which are subsidies. They're subsidies on top of subsidies to insurance companies. Did you read the reports? Last year, 41% of those subsidies on subsidies, of the people that had the enhanced subsidies, paid no premium. So they had no skin in the game, which is not what we were promised when Obamacare came into existence a dozen years ago. We actually showed an economic report. I did entire floor speeches on it, showing only a third of that $35 to $40 billion a year subsidy on top of the subsidies actually goes to health care. We also showed that a third of the folks never made a claim, because now we're finding rampant fraud of people that were signed up because if they don't have a premium to pay, they had brokers signing them up, and they had no idea they had coverage. Where's the passion to actually deal with the fact that particularly the left, and I got to blame my brothers and sisters on the Republican side, we've done the same. We've turned healthcare into financial engineering instead about the cost and access and delivery of having our brothers and sisters get healthier. Is it you've sold your soul to the insurance companies? Remember, the ACA model is an insurance company model. You promise them rates of returns, you promise them a market. So this is 7% of the healthcare market. 94% of that 7% gets a subsidy. So let's actually do math, because you've been listening to, oh yeah, there's been actually no math today as people talked about the subsidies on top of the subsidies. CBO report that updated yesterday, and I can do this off the top of my head, basically said the 3 years cost $80 billion. The reason it's lower than my $105 billion is because they made an assumption that this year, if the Senate were to pass these, that there'll be a delayed sign-up, so there'll be a half a year or so with people. But if they did a clawback, the actual number on these subsidies is about $105 billion. Okay. But even if you do the CBO's number of $80 billion for 3 years of subsidies on top of the subsidies, and then you put in the 10 years of interest, because the interest window, this costs $111 billion. Understand what the left is telling you. They're basically saying they don't give a damn about health care, it's financing. If we wanted to change the price of health care, we would actually be looking at the innovations that are going on and start to legalize them. But there's too many damn lobbyists walking up and down our hallways here trying to stop us. Look, here's an article from 2 days ago. Bless the state of Utah. If you're like me, I have hypertension. Can you imagine that? I've had it since I was a teenager. Something I have genetically. I take a calcium inhibitor, lowers my blood pressure. Hopefully I don't pop an aneurysm. But every 90 days, I got to pick up the phone and go renew a doctor's prescription or go visit the doctor, even though it's the same prescription I've had for decades. Utah just created that AI will take my data and renew my prescription. It will save a fortune for the people of Utah. Cost, access, not subsidies. Stanford Medical Review, basically being able to use certain wearables, their new AI model predicts disease as risk of sleep over 100 health conditions. They take some data as you're sleeping off your wearables, and boom. It's basically you're wearing a medical lab, except the problem is it's not allowed to prescribe. That would be illegal, because that would require us to actually do things, modernize access to healthcare, use the technology to crash the price. Oh, we can't use technology to crash the price. It would really annoy a whole bunch of the lobbyists. People are lined up at our doors. People that show up at our fundraisers. OpenAI Chat Health to connect data from health apps, medical records. There's a revolution coming where we as people of America can stay dramatically healthier. Why aren't we doing the discussion of what to do to lower the price of healthcare instead of having debates of another $100 billion that goes on the very credit cards of the people that get the actually the insurance companies that get the subsidy, that only, as our model is, 38% of that subsidy actually end up going into healthcare. So we're still trying to figure out where the hell the rest of the money went. Have we lost our minds? Why is it so much easier to just keep borrowing money and borrowing money and borrowing money and say, I'm giving you something, but I'm putting it on your credit card? It's like we're engaging a level of financial lunacy here. All right, now let's actually go on to the even more difficult part of this discussion. And I'm doing this because I want us to start to have a benchmark. And if there's anyone out there listening that's ever had to tolerate, because I've been doing these for a decade, and I'm just exhausted. I'm frustrated, I'm angry. My brothers and sisters here, Democrat and Republican, I like most of these people. And I'm crushed. I'm just absolutely intellectually, emotionally, even physically crushed at the inability to tell the truth. Because we don't want to tell the truth because our constituents get pissed off at us when we walk them through the math, because the constituents look back and say, so you've been lying, or the politicians have been lying to us for decades. The answer is yes. But it's not Democrat, it's not Republican. Much of the crisis that we're facing is demographic. I'm not going to explain all this chart, but I'm basically going to tell you, if you look at the financial lines on this chart, Mr. Speaker, it basically says in 3 years, over half the money this federal government spends will go to those 65 and up. In 3 years, half the money we spend will go to those 65 and up. Now, I need you to work through something with me. I've already presented the Moody's Analytics report that's saying in 8 years from now, 30% of our spending, 30% of tax collections will go just to interest. You're now seeing in 3 years the majority of our spending will actually go to benefits here. We've got a math problem. Today, we have fewer 18-year-olds than we had 20 years ago. But we have double the number of 65-year-olds. Okay, we can sit here and blame each other, but it's just demographics, and it's happening over the entire industrialized world, but we're not allowed to actually have an honest discussion about it because the moment you say something, the other side's writing political commercials to rip your face off because you told the truth about math and demographics. It's real simple. You run for Senate right now. So you're going to, Mr. Speaker, you're going to run for U.S. Senate. In your next term, the Medicare trust fund is empty. The Social Security trust fund is empty. It takes that first year, 2033, to just cover that shortfall is over $638 billion. And if you don't fix it, you double senior poverty. You double the number of baby boomers who are going to live on the street. And everyone's Social Security check is a 24% cut. How many people have you heard this week get behind the microphones and say, maybe we should actually start to adopt technology, modernization, actually deal with the reality of our fiscal cliff that's coming? Instead, I watch a parade of my brothers and sisters here say, I have an idea. It costs more money, but it's a really good idea. Let's just put it on the credit card. It's out of order, but I'll get to it. I'm going to say it a couple times because I did a presentation of a report from, I think it's the Massachusetts or Boston Economic Council, freaky smart professors. If you use a 6% discount rate, which you can argue something lower, and I'm sorry, but sometimes you got to talk about math. A child born today, you need 104% of that child's lifetime income. So more money than they make in their entire lifetime just to cover federal pension benefits. Social Security, Medicare, military, federal employees, railroad retirement. Does anyone care? Does anyone care? What's wrong with this place? The immorality that the next generation will be poorer than us. Yeah, but we're not allowed to say that because, let's be honest, people want more stuff, and if we keep giving them more stuff, they vote for us, and they might even contribute. Look, let's just continue to do some of the basic demographics. 2004 to 2024. You see this one line here? Those are 18-year-olds. Okay, somewhat similar. But now you start to get to 2035 and start to understand, without immigration, you have a world where you functionally have more 65-year-olds than you have 18-year-olds. Your ability to grow the economy. Now, we're having debates right now. There's a report out that now it's not adjusted for self-deports, saying the United States had about 400,000 as first snapshot growth in 2025. We have another report that says the United States had zero population growth last year. We have another report that says the United States will have zero population growth this year. Are we going to tell the truth about math? You want your Social Security, you earned it, you deserve it. You want your Medicare, you earned it, you deserve it. But in 7 years, both those trust funds are empty. And so what are we going to do? Is the argument, well, we're just going to borrow more money because God forbid we have any conversation about the cost of delivering health care, because that will upset someone's business model. Our bureaucracy's model. Look, it's hard to read, but the basic point was trying to show we're having terrific economic growth. I'm going to show some slides here. Our GDP growth, some of the tax policies, some of the regulatory policies that have been adopted in the last year are working. Our problem is they're spending. And much of this, almost all the spending growth is interest, because we're refinancing. You know, we got $30 trillion out there. We got to bring to market over the next few years. I think this year, refinance was going to be about $11 trillion. That's bonds, notes, paper that come due, plus another $2 trillion probably in virgin, new issuances. And they're subject to the higher interest rates today than we had 5 years ago. It's why our interest coverage cost has gotten so much more expensive. That's why if you do total interest from last year, the interest we also pay back to the trust funds from the money we borrow from the trust funds, we spent $1.2 trillion on interest last year, meaning interest was the second biggest expense in this government last year. And it's getting worse. So what happens when you produce economic growth? And you see this red here? Our debt projections are actually every bit as bad as last year, which that means for every dollar we take in tax receipts, and remember our tax as a percentage of GDP is basically back to the mean that it's been for decades. For every dollar we take in, we're going to spend $1.43. So one in, $1.43 out. How long can you carry that on, Mr. Speaker? And yet, you start looking at where we are demographically. And frustrates me is this is just what we are. There's not a magic, well, we're going to suddenly have more children. Really? This is happening all over the industrialized world. You have countries that buy you a house on your third or fourth child, and it didn't increase fertility rates. But yet our pension systems were designed on 4 or 5 workers. Remember, Social Security, Medicare are pay-as-you-go. We had a benefit of when the baby boomers were in the labor force, of building reserves. But they ultimately were designed as pay-as-you-go. And for years, look, I've been in a 50-50 district for years, and the political consultants lose their mind. Schweikert, you're not allowed to talk about the truth and math. But no one here wants to even go near it, even the people in 20, 30-point partisan districts. Will anyone here help us plan for the future? Because this future is coming fast. We have economists now say we have functioning 3 years before we get in the interest cycle back and forth. I'm going to try to explain that one of these days. But you got to understand, when we hit, so in what was that? 2020, we had 2.7 workers per Social Security retiree. We're actually hitting the point over here where we think we're down to 2.3, and in the coming decades, it even gets less. So you and your spouse, you and your partner, functionally have your own retired person. It's just to understand the basic economics of the math. And then you get the brain trust here. Well, we'll just borrow the money each year. Really? Did you hear the math? In 2033, so the year the trust funds are empty, it's well over $600 billion. So you're going to borrow basically half, 40% equal to what is the, well, actually almost 60% equal to today's defense budget. And you're just going to throw that on the credit card. And the next year it's bigger, and the next year it's bigger. Look, there's good things happening. The GDP numbers, which means the baseline economic growth numbers, are remarkably healthy. There's huge investments going on right now in technology that could actually boost productivity, therefore boost wages. But where's the unified theory here? If we're going to do another reconciliation where we're going to tell the markets that we're going to start limiting the spending so we get lower interest rates so we can have more market growth, people can afford houses, all the inputs, but instead, you have a government that for every dollar we spend, we have to borrow another 43 cents. This is insane. And look, I was going to try to walk through some things I consider really hopeful. You know, these are the contributions to GDP growth. And many of these contributions in the GDP growth, if we can get our policies and our regulatory designed properly, we can get some pops in productivity. And pops in productivity means pops in people's wages, pops in tax collections. But you got to get all the stars aligned at the right time. And I just don't see us doing that because it's somehow like it's not part of our lexicon. But yet, I will do presentations. And we have too many people, particularly even on my side, we say things that aren't mathematically true. We hear something, we repeat it. The customs duties, tariffs, are helpful. But it's not as much money as so many people think. Look, I'm blessed to chair the Joint Economic Committee. I'm number 4 in Ways and Means. I'm chairing the oversight, so I'm the guy running a bunch, or responsible for a number of these really uncomfortable investigations. I'm blessed to have a staff that's a hell of a lot smarter than I would ever have hoped to have been at their age. But you start to work out charts like this. Okay, and I'm going to make some people mad Matter of fact, I'm not going to even bother you with that one. I'm going to walk you through the straight number. And we're still vetting the number because we're doing predictions. And all this could mean nothing if the Supreme Court tomorrow changes its rules on the president's authority to do the enhanced tariffs. Let's just call them that. And what other authorities the president may have to supplement those tariffs. But you got to understand, our latest articles we're looking at saying, hey, for 2026, $215 billion of what you call custom receipts, tariffs. Okay, but the baseline, if there had been no changes, would have been $84 billion. Okay, you all working with me on this? That means there was $131 billion of new tariff money coming into the budget this fiscal year. Well, if you pull out your calculator, so far in the first quarter of this fiscal year, we've been borrowing $8 billion a day. Now, we're hoping it actually comes back to the mean of being about $6 billion, but let's do 131 billion divided by 8. You're functionally covering 2 weeks of borrowing. It's helpful. It's not a solution. But yet, I'll do this speech. I will ask anyone that's watching if you have some suggestions of how I can actually start to break through. Because I'm exhausted. And then I will watch someone come up, and I'm sitting there in my office watching the floor, and on occasion I'll pull up my calculator. I'm just enraged because of the mathematical lying that goes behind these microphones over and over and over. This is the survival of your republic. So let's actually do something that's semi-optimistic here. Waste and fraud. Okay, now I had a meeting with a wonderful woman the other day. She actually is involved in our county party, really smart, absolutely lovely. And I hope I misheard her, but she seemed to believe that, if we just hadn't had that fraud in Minnesota, we could have covered a whole bunch of our national debt. And she was genuinely concerned. And it sounds like she was trying to quote what she actually thought she heard on cable news. And I had to walk her through saying, okay, here's the best projection, the debt over, remember, some of this fraud may have happened over a decade. We're still getting all the numbers. There's already been a number of prosecutions. Minnesota woman pleads guilty to $250 million feeding our future fraud scheme. $250 million she stole. There's a number of these articles I have here, but you still got to do the math. And the fraud looks like it's, just give you an idea of the scale of our nation's borrowing. It's only a couple days of borrowing. It's how do I help people understand the perspective of the scale and the fact that the everything we as members of Congress vote on is borrowed. If you told me today I have to balance the budget, I can do it. Every part of government has to be shut down. No Park Service, no Congress, no EPA, no FDA. Everything is discretionary, is gone. And today, my math is several $100 billion of mandatory spending have to be gone. Because we're borrowing so damn much money now, we have to borrow money just to cover our Medicare obligations. Do we understand? So what if I came to you tomorrow and said, hey, I can end most of the fraud in the IRS and the government and the SNAPs and all these subsidies, welfare, nutrition support programs. We've actually had a bill for 6-7 years to use AI to audit the Pentagon. The Pentagon, I think last year, was its 9th audit. It failed. It could not pass an audit. The same technology we wanted to use to audit the Pentagon, turns out all these programs, you just put that in the back end. Instead of doing the pay and chase model that for some reason the left seems to embrace, why let the fraud money ever go out the door? I want to give you a simple example. How many of you have a credit card? How many of you have ever gone to a place that you've never purchased before, and you stick your credit card in because I'm going to buy some fishing tackle or whatever the hell you're buying, and suddenly you get this text message saying, is this you? Can you put in your PIN? Can you put in your code? Can you? That technology's been around for a decade. If the credit card companies now have even more advanced AI to know that someone isn't you, that it's fraud, that the data on your application, other things are fraud, you're telling me that the billions and billions and billions and billions and billions we put at risk trying to help our brothers and sisters, only to later find out we've been financing scammers. So I have a passion of dealing with the long-run debt of this country. How do I convince American people that we're going to have to do hard things when they're able to point saying, yeah, but you haven't taken care of the filth and the stealing from our society, from our taxpayers? How do I get them to trust me when I still have the scam artists robbing them? Mr. Speaker, we have proposal after proposal to use technology to stop the scamming. Will it ever get a hearing here? There almost seems to be a war to stop us from using technology because I actually can't give you an honest answer. We know for years I've been trying to use fix technology at the IRS, and the IRS union loses its mind thinking, you're trying to get rid of us. When we've been doing the audit the Pentagon, the unionized auditors come and want to have meetings with me. They're concerned we're trying to get rid of their jobs. I'm just trying to protect the American taxpayers. But the technology already exists in the private sector. It's time we adopt it. On healthcare, I just want to give this as an example. Utah, a couple days ago, announced they're going to allow AI as a pilot program in Utah to prescribe. Now, it's for renewal of your prescription. So as I was talking about before, my calcium inhibitor, my hypertension medicine, same one I've had for decades, I could plug in my data to the AI and it would order my prescription and it would be sent to me. And it functionally has almost no cost. We have dozens of examples I have brought to the floor here over the last, actually, dozens and dozens and dozens of examples I've brought to the floor here over the years showing how we could crash the price of health care instead of doing the scam of, let's just keep subsidizing the subsidy and the insurance companies. How about we change the accessibility and use technology to make it less expensive? We're actually working on a thought experiment, and this will be the end, a crazy thought experiment. And President Trump and the White House actually get a lot of credit, though we worked on this for years. Glutites, GLP-1s. I believe by the end of this month, one of the tablet versions will be available for $149 a month. If obesity is responsible for 47% of U.S. healthcare spending, according to the Milken study, what would happen in our society, particularly we have states where technically over half their population is considered obese. What would happen if access to the drug, and hopefully nutrition, all the other things that need to go with it, but just do this thought experiment with me. The lobbyists weren't able to stop access to the glutites. You might be on the cusp of a revolution of people who are morbidly obese, that have multi-chronic conditions, who are losing their feet, about to get healthier. Let's actually start accepting the technology, thinking creatively. With that, Mr. Speaker, we might be able to do some amazing things out there. And I yield back.
Under the Speaker's announced policy of January 3, 2025, the Chair recognizes the gentlewoman